Hello everyone, welcome to this presentation on ADHD, which is specifically for parents. I am your host Cecilia Dunn. Let's get started. We are going to firstly be going over what is ADHD, how will we know when we see it, distinguishing ADHD from other disorders, how often does it occur and what are its correlates, demographic risk factors, hypothesized cause, course of disorder, and causal factors. More on ADHD, such as the duration, reoccurrence, and long-term risks of ADHD. Why it's important to work with a marriage and family therapist. Family and society's responses. Treatment and side effects, followed by a summary and references used. So I wanted to go over what is ADHD. ADHD is a neurodevelopmental disorder that is highly impairing for those affected in many areas of their lives that I will further explore. So I know as a parent you may be asking, how will we know when we see it? Well, let's start out with the assessment process. Firstly, to have an accurate assessment, a therapist should observe how the child conducts themselves in various settings, such as in school and at home. The therapist would want to have the client's medical and psychiatric history to note whether the child has co-occurring conditions, developmental delays such as intellectual disabilities, and other areas that a therapist or physician questions about how the individual's upbringing has shaped them and what environment they grew up in. Now, in order to diagnose a child with ADHD, a therapist is going to refer back to their DSM-5 to assess the diagnostic criteria. Starting with a child with ADHD is going to persistently convey patterns where they are unable to pay attention to, as well as convey high levels of impulsive behavior where the child may act out or say something without examining the outcome. They also may appear hyperactive. Educators and parents may notice that the child is consistently making mistakes on schoolwork and overlooking details in their work. They have great difficulty sitting through lengthy activities, classes, meetings, where sustained attention is required. When speaking to an individual that has ADHD, they may not recall what was just spoken to them, and it may seem as if they are lost in their thoughts. They have great difficulty with organization, following through. They will display hyperactivity and impulsivity in various ways, such as being unable to sit still in their seat or in other places where they are required to sit down, such as in the classroom, in the workplace, maybe church. They may seem defiant because they have this strong desire to just run around and climb on things that are not appropriate and at not appropriate times as well. They may seem as if they cannot slow down and they're restless. They have great difficulties playing with other children because of this inability to just slow down. They play roughly and with intensity, and it's hard for them to wait to be called upon in the classroom. They might blurt out the answers even though they weren't called on. In conversations, they are likely to interrupt other people who are talking. Lastly, in part of having impulsivity, they may seem erratic, using other people's things without permission, such as a student deciding to use another classmate's pencils or crayons. So in order to be diagnosed with ADHD, a child must be 12 years or younger when symptoms start, and they should have 6 or more symptoms. and these symptoms are likely or they should have been occurring for 6 months or more. For adults, they must have at least 5 of these symptoms which have been stated. For individuals with ADHD, these symptoms will impact the quality of their life and would be seen at home as well as other places. Distinguishing ADHD from other disorders. Remember, the main symptoms presented in ADHD are inattention, impulsivity, and hyperactivity that is going to be seen for some individuals through their entire childhood years and for others through their lifespan. Not every child who has ADHD will appear the same. Some children or adults may have symptoms of inattention or may have more hyperactive or impulsive symptoms, and some children have both inattention and hyperactivity. There are other disorders that can seem like they could fit into ADHD's diagnostic criteria. That is why a full psychiatric evaluation should be conducted, because there are conditions that mimic ADHD, such as learning disorders and anxiety. There are also certain mood disorders, substance abuse, or trauma can also mimic these symptoms of ADHD. These disorders and conditions would present additional symptoms unrelated to ADHD, such as nervousness, worry, anger, or depression. Symptoms of other conditions would not be consistent as ADHD is, but who would be more episodic over the lifespan. So, look, how does this occur and what are its correlates? Well, if we look at the prevalence rate for children and adolescents, it's 5% for adults and about 2.5% for children and adolescents. Boys are twice as likely to have ADHD than girls. In girls, ADHD often manifests higher symptoms of inattentiveness than for boys. The median age of onset is 6 years old. Now, in cases where the child presents more severe symptoms, the median age is 4. The median age for children who present milder symptoms is 7. For adolescent youth, the age is between 13 and 18 years old. Half of adolescent-aged youth that have been diagnosed have severe symptoms. And as I said about boys having a higher rate, in adolescent-aged youth, males have up to 3 times more ADHD than female adolescents. Okay, so if we're looking at demographic risk factors, the highest among special populations where children are in foster care or residing in a correctional location, and children who have been exposed to violence and or trauma is reportedly higher amongst children where their parents and caretakers have a lower education level. It's also high amongst children who have grown up below the federal poverty level. If we are looking at ethnicity, research shows that non-Hispanic Black children had the highest rate of ADHD diagnosis over white and Hispanic children. These differences are thought to be for various reasons, such as having a lack of information about ADHD in the African American communities, and minority families may be not seeking proper treatment for hyperactive symptoms. African American parents may feel differently than, say, the white parents about their child's symptoms in general. It is undeniable that racial disparities still do exist in many areas, especially as in receiving proper mental health care, and people who are poorer may receive inadequate care and diagnosis. Okay, so here's a little more information on the attention deficit hyperactivity disorder. ADHD can begin as early as 3 years old and last until adolescence or adulthood. ADHD varies on the person's severity, and symptoms can change as a child grows older. Once the child becomes a little older, symptoms of inattentiveness may become more noticeable. A child may struggle to pay attention to the teachers, fidget with hands and other objects, or may seem as if they cannot sit still in their seats. In the long term, it can cause a person with ADHD to really struggle academically because they're not able to focus on instruction or learn the material. Reading can be extraordinarily difficult because many times the individual affected by ADHD loses concentration or becomes distracted by something else. Children and adults may experience social rejection from peer groups. They are more likely to lose friendships as they grow older and/or endure teasing. Individuals who continue to have symptoms as adults may continue to struggle with relationship problems, have impulsivity, and may develop antisocial behavior. If untreated, they will continue to have interpersonal conflicts. In adults, they will struggle to find and maintain employment. It is likely that they may struggle with substance abuse problems and may get involvement in vehicle accidents where they are injured, as well as having a risk of being incarcerated. The best treatment recommendation is to use a multimodal treatment approach. A multimodal approach is about providing an array of support for the child and their families, which includes psychoeducation with the latest research findings on ADHD, behavioral and psychosocial interventions, pharmacological, and support from the school that the child is in. Work with a marriage and family therapist. What makes working with an MFT for treatment of ADHD a good option for parents? Working with a marriage and family therapist can help an individual at all stages of development who have ADHD from childhood, adolescence, to adulthood. A therapist will work with the individual to help them with a variety of skills such as reducing behavioral dysfunctions, helping the client to reduce and make sense of the distress that has been caused by ADHD, focusing on the client's strengths and helping them to see what sources of support they have around them, as well as finding resources for support. This approach is different than just simply going to a doctor and getting medication, because medication alone is not a cure in itself. A physician does not have the time or expertise to discuss behavioral therapies or offer educational sessions. Physicians also cannot assess for coexisting conditions and other conditions that could be affecting the child. The physician can make referrals and offer resources to their patients. What is family and society's response? So what does society think and do in terms of ADHD? Society tends to think many negative things about children with and adults with ADHD. Common beliefs are that they are not trying hard enough in school and reaching their full potential. They are seen as non-compliant, lazy, embarrassing, uncontrollable, rule breakers with an inability to behave appropriately. Furthermore, they are also thought to be irresponsible and careless. As you can see, the stereotypes and judgments often made about individuals and their families with ADHD are very distressing. Some stereotypes that families themselves hold their loved ones with ADHD is that having a mental or neurodevelopmental disorder is shameful and less acceptable in society than individuals with physical disabilities. Some culture groups also may find a great difficulty in accepting their child who has a neurodevelopmental disorder. Others who look at the family of a child or an adult with ADHD may think that it's simply a result of bad parenting or improper discipline. In many ways, society treats children and adolescent youth with ADHD as if it is their fault. Families' responses to stigma might be to try to avoid the diagnosis as much as possible, and by ignoring these symptoms, they're hoping that the child will eventually outgrow certain behaviors in time. Families may be fearful about having their child use medications for ADHD because there's this false perception that taking medications can lead to substance abuse later on. Researchers have shown that this is just not true and does not increase their risk. Another myth is that medication will magically help the children and adolescents to suddenly have the ability to become more organized and undo years of unhealthy coping. So how can a therapist approach parents who do not want to medicate their children. It is important to inform parents and families through patient education or in person, detailing what medications are used and how they can be effective in treating symptoms of ADHD. As a therapist, I would take the time to inform parents and families that while medication can help to dramatically decrease psychomotor activity as well as symptoms of impulsivity and aggression, it is important to teach children coping strategies in order to learn key organization skills and learn ways to problem solve. That way they can learn to become more adaptive and receptive, and also to receive supported psychotherapy. In this slide, I just wanted to go over the latest treatment recommendations more in depth. When a child or adolescent is diagnosed, it's important that classroom management procedures are put in place, such as adding an IEP or a 504 plan for the child so they can receive the accommodations that they need in the classroom. A therapist may begin working on behavioral treatments that will also help the child in the classroom and at home. Pharmacological treatment recommendations are psychostimulants such as methylphenidate, which is also Ritalin, and dextroamphetamine. There are other medications that can be used for ADHD, but these medications may not be as effective. These include clonidine, guanfacine, and atomoxetine. Medications can provide a symptomatic improvement as they target dopamine and norepinephrine chemicals in the brain. Side effects include appetite suppression, possible sleep disruption, and possible stunted growth in 1 inch or less of height. ADHD is a neurodevelopmental disorder that affects children, adolescents, and adults. The symptoms can range from very mild to causing significant impairments. Common symptoms are hyperactivity, impulsivity, and inattention. The assessment process involves observing and taking a report of the individual how they are in various locations, and looks at the individual's medical and psychiatric records to determine if there is any pre-existing conditions. The prevalence rate shows that this disorder is highest amongst children and males. ADHD affects many areas of life that can cause a hindrance to how an individual functions and how they socialize, and with employment and how they feel about themselves. And it is difficult to pinpoint an exact cause of ADHD, though there are many contributing factors that are genetic, that are environmental, and also neurological. It is important for parents, families, and those in the school system to have an understanding that ADHD is a real condition and not simply disobedient behavior. Individuals with ADHD should not be stigmatized or ignored. We know that with a proper diagnosis and multimodal treatment, the individuals can manage their symptoms and begin having a success in their lives. This concludes the presentation on ADHD. I want to thank you for watching. Here is a listing of the references I used. Thank you for now.